Dr. Roy Sweat used to always say that, drugs and surgery is like being in the jungle because you never know what's around the next corner.
Welcome to AMC. I'm Dr. Greg Miller. Do you routinely compare treatment options with your patients? Today, Dr. Todd Osborne is going to cover this important section of the 6 C's. Don't miss his example about a patient with anterior thigh numbness. If this video helps you, please click the like and subscribe buttons. Let's get started.
So let's talk today about the 6 C's and in particularly comparative treatment of the 6 C's. Really, this is such a great advantage for you when you can talk about the comparative treatment with your patients because it helps them make a more intelligent decision. Because quite frankly, they don't know what you know about the other treatments that are available for the type of conditions that they're bringing into your office. And so they just follow the flow in the medical side of things, and they don't understand the side effects. They don't understand the cost factors. They don't understand the failure rate that's going on out there. And so if they don't know that, how can they make a great comparison to your treatment and what you offer for the patient? So let's get into that and talk about it a little bit today, and how to utilize this in your office to help your patients make better decisions. And that better decision is typically getting under your care and staying away from side-affecting drugs and life-altering surgeries. And so what do we get when it's on the musculoskeletal phase of things, right? They originally go in, they're going to get muscle relaxers, anti-inflammatories, and pain meds, right? And now the pain meds, with the opioid epidemic and everything that's went on with that, that's a whole nother ball game. And so they're using gabapentin and these other type of drugs now to try to stay away from the opiates, and it's a jungle out there. And Dr. Roy Sweat used to always say that, drugs and surgery is like being in the jungle because you never know what's around the next corner. And so look at the side effects of those drugs. Can they be effective? Yes, they can be effective on the short term, right? But what are the side effects down the road? And are they really treating the cause? That's the origination of this patient's symptoms or syndrome that they have. And no, they're not. So it's short-term fix at best, and that leads to long-term degeneration that's going on in there. And down the road, then it's more anti-inflammatories, or we're into injections, or whatever the case might be. So help your patients understand that those treatments, that comparative treatment for this, there's side effects that go along with that, and it's not even fixing the cause of what's going on. And then, if that doesn't work, that doesn't get the results that they're looking for, then what? Okay, it's all the diagnostic, the MRIs, the CTs, the CBCTs, everything that goes into that. And then what's next? It's surgical, right? And so when we're talking about back pain, neck pain, then they're right into the surgeries. And your patients need to understand the fact that 40% at the bare minimum and up as high as 80 to 85% of back surgeries fail. And so they need to understand that they have a very, very low percentage chance of that actually helping them, or what would consider being successful in the medical realm. And beyond that, they need to understand that we actually have a surgeon, an orthopedic surgeon, where we practice, that had a patient in there, told them, listen, if you have this back surgery, you're going to be back in somewhere between 2 and 3 years to either get the segment above and below or below done again, or done too, if I do a fusion here. And so the surgeons are telling them this right off the bat: you're going to need more and more surgeries. And guess what? The more surgeries they have, the less percentage success rate there is. So that goes down after the second surgery, and then the third surgery, it plummets. So understand that you need to talk to these people and tell them about that. Even if they're, there's PT, there's some of these other things that they can do, but again, they're not correcting the cause. They're treating the symptoms and not correcting the cause. And that's what you have to continue to reiterate with your patients so they can make the best decisions possible. And I have story after story after story of alternate treatments that people have done or have the option to do and decided not to do that. But, I had a recent patient that just came in. Unfortunately, they came in after the fact, and this lady is having all kinds of neck pain and facial pain coming into her jaw and that. And they have extracted, they've done root canals and then turned around and extracted 5 of her teeth. This lady's somewhere in the neighborhood of 30 years old and have extracted 5 of her teeth because of this facial pain that she's been having. And we give her one adjustment, one Atlas adjustment, and she said all this pressure was coming out of her face within a matter of minutes. And so unfortunately, she didn't know about the comparative treatment beforehand. Well, she does now, and I wish we could have gotten there sooner with her, but we didn't. And just more recently, I have someone acquainted with me that is overseas and had to go see a medical doctor over there in the military. And he's having numbness and tingling in the anterolateral dermatome of a thigh. And it's been going on for over a month. And he's tried everything that he can conservatively, short of he can't get good chiropractic care where he's at. And he went into the MD, and the MD said, oh, well, if that's tingling and numbness in your anterior thigh there, that is absolutely not neurological, not coming from your spine. You're wearing your belt too tight. And so I'm just like, you've got to be kidding me. This is the type of care that's out there. So many times the comparative treatment or comparative diagnosis, if you will, is way off base. But even if they do get down on and get on the right track of things, what they have to offer is nothing compared to what you have to offer. And you can offer them natural care to allow their body to heal itself and adapt to the environment the way God designed it to do. And you don't have to worry about the side effects of the drugs they're taking. You don't have to worry about the failed back surgeries that are irreversible, folks. And that's another thing to talk to them about. Once you do that surgery, guess what? It's irreversible. You can't go back. So they need to understand that the treatment that you offer is going to give them their very, very best chance of being completely healed and completely restored, and nothing on the comparative treatment side is able to do that for them. So start using this with your patients and making sure you're talking about comparative treatment. You all have your own stories of what people have come in with. You hear what's going on out there in the medical world from your patients. So make sure that you're sharing that with them, giving them the knowledge they need so they can make the best decision possible.
Doc, AMC is your guide to becoming respected, effective, and valued in practice. We know what works, and we prove it with our Grow Guarantee. If we can't help your practice grow, it costs you nothing. Text us at 966-4996 for more details. See you next week.